Protecting ourselves and others from potentially infectious organisms is a vital aspect of healthcare. The three components discussed in this video are risk assessment, hand hygiene, and the proper use of personal protective equipment, or PPE. Risk assessment. Perform a risk assessment each time to ensure you are wearing the correct PPE for the intended task. Some important questions to ask yourself include: what contact am I going to have with the client or their environment? What is my risk of exposure to blood and body fluids from the client, their environment, or contaminated equipment? Hand hygiene. The 4 moments of hand hygiene opportunities include: number 1, before contact with the client or the client's environment. Number 2, before any aseptic procedure. Number 3, after contact with the client or the client's environment. And number 4, after contact with blood or body fluids. This also includes non-intact skin. Hand hygiene can be performed either by using alcohol-based hand rub or washing with soap and water. Alcohol-based hand rub is the preferred method of hand hygiene. Soap and water are required when hands are visibly soiled and in exceptional situations, such as caring for clients with Clostridium difficile and norovirus. Place approximately a quarter-size amount of hand sanitizer into the palm of the hand, rubbing hands together until all hand and finger surfaces are covered. Remember to include your thumbs and the backs of your hands and wrists. The entire process should take 20 to 30 seconds of rubbing until hands are dry. Washing with soap and warm water, not too hot or too cold. Wet hands and apply enough soap to cover all hand surfaces. Rub hands palm to palm and between fingers, palm to back of hands with interlaced fingers, fingertips and knuckles into the palms of the hand. Scrub the thumbs separately as well as the wrists. Rinse well with the running water. Dry hands with paper towel, using the paper towel to turn off taps and open the door handle of the room you're in. The entire process should take 40 to 60 seconds. Personal protective equipment. The choice of personal protective equipment will be dependent on the risk assessment. Proper donning or putting on and doffing, removing of, personal protective equipment is vital to ensure the safety of the healthcare worker. There are different kinds of personal protective equipment available depending on the location of your job and the tasks in your job description. This video will demonstrate the proper way to don and doff basic personal protective equipment for routine practices. Routine practices refers to the level of care that is provided for all clients at all times in all healthcare settings to reduce risk of blood and body fluid exposures to the healthcare workers and to prevent and control transmission of microorganisms from both recognized and unrecognized sources. The first part of the donning process is to start with clean hands. Next, inspect your PPE as you're putting it on. Check for holes, rips, or tears that could compromise your safety. Never reuse personal protective equipment unless it can be disinfected with a hospital-approved disinfectant between each use, such as your goggles. Put the gown on, making sure that the gown covers all aspects of personal clothing and can be tied securely at the back of the neck and side. Avoid tying at the front of the gown because the sleeves and the front are the areas most likely to be contaminated. Tie it in a bow to facilitate easy removal. Wear a mask and eye protection when appropriate to protect mucous membranes during activities that are likely to generate splashes or sprays. Ensure the mask fits well, covering both the nose and the mouth. If you're wearing an N95 respirator mask, ensure the back strap is sitting on the neck and the top strap is secure on the crown of the head. Perform a seal check each time. If required by risk assessment, don eye protection using either a full face shield or safety goggles. Lastly, put on gloves. The gloves should cover the cuff of the gown.
Audio Jungle.
Doffing. Correct doffing of PPE is very important. The healthcare worker should work slowly and methodically to ensure safe removal of PPE. Begin with the gloves. Remove them using the glove-to-glove technique. Place gloves in garbage and perform hand hygiene as soon as gloves are removed. Next, remove the gown. When undoing the neck ties, keep the elbows pointed outward. This will help keep the sleeves away from your head. Carefully remove the gown by rolling it down away from your body into a tight ball and put it into the garbage. Exit the client's room. Perform hand hygiene. Carefully remove eye protection if it was worn. If wearing reusable equipment, place in a designated container for disinfection. Otherwise, place it in the garbage. Perform hand hygiene again. Carefully remove mask by grasping the straps or ties. Lean forward at hips and remove the mask from the face. Never touch the front of the mask. Discard it into the waste container. And the final stage, perform hand hygiene again.